I'd like to introduce Dr. Amy Bohnert, who is an associate professor of psychiatry at the University of Michigan, and she is co-leading a different precision health study. She is a nationally recognized leader in the area of prescription drug safety and substance use disorders, and now she is turning some of her attention to mental health care. She's going to share about a project that recently started, which is designed to enhance mental health care. Sorry, my coworkers are barking. Enhance mental health care through mobile technology, which is also funded by Precision Health. And so with that, I'm going to turn it over to Dr. Bohnert, and then after that, we will come back and do our question and answer session.
Great, thank you, Vicki, for that introduction. It's wonderful to get to present alongside the opioid use case. So mental health was the second signature area of the Precision Health program broadly in terms of these signature projects that will hopefully provide data resources for people across campus. I'm going to talk a little bit about the background for the project, what the design is, hopefully with an eye towards the experience of people who are participating in the study, and then talk a little bit about our early experiences now that we've been collecting data for a couple months with participant engagement. So in terms of why Precision Health was chose to focus on mental health, I wanted to start with this as context. So these are changes. So this isn't the absolute number of deaths or death rates, but these are changes over time. And you can see that while things have held relatively steady for most of the common causes of death in the United States, that has not been true, or in some cases actually even been reduced. That has been not true for suicide and unintentional overdose. And while we often think of overdose as an issue of opioid prescribing, actually some of the strongest risk factors for overdose are mental health conditions, and not just addiction related ones, but also depression, anxiety disorders, other serious mental illnesses. So this points to the fact that there are really major lags in the quality and use of innovation in care for mental health relative to a lot of the rest of medicine. And that's really been remarked upon well by a prior director of the National Institute of Mental Health, who put out this opinion viewpoint on how the fact that compared to a lot of other areas of medicine, what we do is very subjective. So basically we ask patients how they're feeling and decide whether or not to change course and treatment based on that. We have very little to no objective measures of mental health status. Care is episodic, so we give you 12 sessions of counseling if that's what your insurance covers, and then we stop. They're just periods of care. It's not really viewed through a long-term maintenance. It's based through clinics, so there's very little integration of mobile technologies, and there, as a result of this poor design of pretty high clinician effort, clinician burden relative to the size of the workforce, there are very long wait times. So it's not uncommon for people to have to wait many months before they get in seen for an appointment. There's also a lack of matching to treatment to a particular individual's needs. So of course, kind of the core ideal of what precision health could be done here is particularly lacking in mental health, where essentially there are a lot of different alternatives and clinicians tend to use what they tend to prefer without regard to a particular patient's characteristics. This is where mobile technology and sometimes what's called digital phenotyping, meaning passive digital measurement of mental health status, has the potential to transform mental health care. So this can provide objective measurement through passive measures that come from one's cell phone or wearable sensors. It can be continuous, it can be ubiquitous, and mobile technologies can also fill in this gap of entirely clinic-based care that is driven by the need for a large behavioral workforce that does not exist. In particular, we've been thinking about the role of cell phones, which are ubiquitous in the United States, and smartphones in particular, which have apps to deliver therapy modalities, and sensors. So here's an Apple Watch. We're using Fitbits in this study, but the ability to have continuous measurement. This is a summary of why that sensor activity and other information you get from cell phone can be used to passively measure mental health status. So as you can see, a lot of characteristics, particularly activity and sleep duration, have been shown to strongly associate with people's self-reported mood, so have the potential to replace those inventories and actually provide a more objective measure of someone's status. However, that is not yet in practice at all. So this is something that is early and promising, but I think a lot of potential. This is from the co-director of the mental health, of PROMPT, of this mental health project, from his lab, Srijan Sen. Sorry, I forgot to mention him at the beginning. They have put Fitbits on medical interns for a year and found, established here very clearly, that sleep and mood track quite well. I mentioned also the potential for apps to deliver care. I apologize that this is somewhat of a busy slide. This is a meta-analysis of randomized control trials of many different app-based interventions. You can see overall from that final line at the bottom of the meta-analysis conclusion, on average, there is some benefit of mobile app-based therapies relative to comparison conditions, often just control conditions. And while it's not a dramatically large effect when you consider how low cost these interventions are and the fact that the alternative actually is receiving no care because of the delays in care, this is pretty remarkable. This is also from a study from Dr. Sen's lab, and I think this gets at how the next step for those mobile interventions is to think about them from a precision perspective. So this is from that intern study where they provided notifications to people based in behavioral activation and motivational interviewing to use feedback from the data that came into their Fitbit to provide a tailored message around their sleep in particular. And they replicated this for activity and mood and some other domains. But for the sleep notifications in this example, what this shows is that for people who had higher average sleep in the prior week, the effect of getting a notification on their sleep actually reduced their sleep in the future after accounting for regression to the mean. So there was almost some negative effect of getting a sleep notification if your sleep was already good. And in contrast, for those people whose sleep was poor in the prior week, getting a sleep notification nudged them towards improving their sleep in that week. So while this is also still just an emerging area, I think it shows some promise for the idea of taking a precision approach to mobile interventions and delivering the right messaging, the right app to the right person at the right time. And also for integrating the information you can get from a sensor to make this really in the moment appropriate for that person. I would be remiss to not mention the potential for a genetic component here. So depression in particular, but this is true of all mental health disorders, has been established to be clearly a condition with a strong genetic component, but it's also very complex. The degree to which genetics have been used to inform treatment decisions is still also very limited at this point. So there's a little bit of work that's been shown around differences in metabolizing major antidepressants that can inform choices, excuse me, a little bit between major classes, but there's still a lot more that can be learned here, a lot of potential. So that brings me to the specific goals of the of PROMPT, which is this mental health use case funded through the Precision Health program. Our overall goals for this project are to increase treatment capacity through mobile health and to accelerate recovery by matching treatment to patient. So to do so, we are recruiting a large number of patients from the University Health Service and from outpatient psychiatry at the university, and we'll hopefully be continuing to expand in other sites and clinics as we go forward in time. We're trying to recruit people while they're on the wait list, so ideally with at least 2 weeks from when they're recruited to when they start having in-clinic appointments, but often much longer than that. And for that period, they will be randomized to mobile health interventions based on different groups that I'll show in a second. And so we'll have data from that period of a classic randomized control trial design for analyses, but then we will also have an observational period. We're not going to interfere at all with the treatment decisions that are done by clinicians, at least for this first stage of the program. Hopefully we will eventually implement some of what we learn into practice. So for that period, there will be also observational data on what treatments they receive, and they'll continue to have access to the mobile health interventions they were randomized to in the first component. So what are those mobile health interventions? First, we used 2 app-based interventions, kind of off-the-shelf programs. For mindfulness, we are using Headspace, and for cognitive behavioral therapy, we are using the app Silver Cloud. These both have existing evidence on their efficacy in more straightforward samples. We then worked with the company Care Evolution to develop a tailored feedback intervention. So this is where that integration with the Fitbit data that people are wearing comes into play. You can see that we help summarize people's information in terms of daily mood scores that they put in each day, or that we ask them to put in each day, their sleep information from their Fitbit, and also their activity level by way of steps. That is given to them in the study app, which they can view anytime with this table, and will also be how they finish their surveys for the study. But they also get push notifications. You can see the example there. So this is much more passive in terms of the use of measurement and giving them tailored messages that are specific to their sleep and activity data and their mood scores. It also, sorry to go back, we also hope, although this will be something that we're testing, that this feedback mechanism, because it nudges them to use the Silver Cloud or the Headspace for mindfulness more, that it will also improve their engagement with those other apps, which is why we designed our randomization this way. So we're recruiting individuals while they're on the wait list. In the first step of randomization, they're randomized between 3 groups. So that's the tailored feedback app, the mindfulness from Headspace, or the cognitive behavioral therapy. And then in those latter 2 groups, they additionally get randomized to either receiving that feedback as well, with the notifications and with the table that shows them their personal data, or not getting that feedback. So in total, 5 possible groups to be in. We supplement that with survey data of the common mental health inventories at 6 weeks, 18 weeks, which are meant to capture periods when they're starting to get engaged into mental health treatment, and then also 12 months. And that's, of course, in addition to that daily, on a scale of 0 to 10, what is your mood today in the last 24 hours? So this is a schematic of how we hope this could lead to identifying personalized treatment planning. The first box under mobile-based there are the things that we are already getting from the Fitbit data. The other ones are hoping that we can expand into as we go forward into time, that require a little bit more work from extracting things from cell phones and from users. We are, there's some promise for using genomic risk scores in particular with mental health outcomes. And then we are also collecting those demographic and environment information, and plan to take advantage of the geolocating efforts through Precision Health, since all of the participants are already coded for that. So we will study mental health outcomes. We will do that both in terms of the mobile intervention receipt, and then also in terms of the medications and counseling that people get through the regular clinic. And then the analyses from that will inform future personalized treatment planning. So with that, I want to talk a little bit about our recruitment experiences so far. So as you can see from the dates here, we started recruitment after all of the restrictions on research went into place because of the COVID pandemic. So all of our recruitment has been virtual, which wasn't necessarily how we were planning to do it. And it also had a major impact on the number of new patient appointments being scheduled at both outpatient psychiatry, but especially at the University Health Service, because the students went home. So recruitment has been somewhat slow. You can actually see a pretty clear inflection point there around our 100th participant. And I believe what that was is that the Precision Health staff built a study dashboard for us to aid recruitment, which made the whole thing a little bit less effortful on staff, and we were able to increase our capacity. So many thanks to Sessions team for that. And so we're at about 260 participants as of today. I have some recruitment data that is about a day old. Nice thing about working with Care Evolution is you get this very up to the date. Like people seeking care for mental health in general, our gender distribution is more female than male. It is also on the younger side, especially compared to MGI and some of the other cohorts that are recruiting individuals from other parts of the university. In general, about 2/3 of folks are Apple iPhone users in terms of the device they're using. I wanted to talk a little bit about engagement. So we have been really excited about what the survey data has meant in terms of participant engagement. As you can see here, the survey completion rates are quite good, especially because it's been largely relying on notifications through the Care Evolution app to engage people in completing those. But what's really exciting are these daily mental health assessments. So what that means is of about 14,000 daily one-item assessments set out, 80% of them are complete. So for every 10 days that participants are asked to complete the daily mood measure, the one time in the app, they are completing at about 8, which is quite high. You know, I'm sure people have a mix of prior experiences with doing this kind of research. In my own studies, it's not uncommon for this to be more like 40%, especially since we're not compensating people for completing those daily moods. So this is really exciting. This is going to give us a lot of data to work with. It's really dense data. I think it also speaks well to how much people are liking the app. I think a lesson learned for me is it also really helps if you are offering people care in place of care they want but cannot get in terms of their engagement with a study, as opposed to asking them to work on research that's for something outside of the problem that they're seeking care for. I also have this quote from a participant who unprompted gave us some feedback about the study. He said, "I'm appreciating being in the study. It's helpful to feel like I have someone to be accountable to that is encouraging the mindfulness." So I think particularly speaks to the potential for that combining different apps to make each one a little bit more potent. With that, I want to acknowledge and give my appreciation to the co-director of the program, Srijan Sen, to the participants in the study. The prompt team on this project has been really hardworking and really helped give participants a positive customer service experience from being in the study. UHS and psychiatry clinical teams and the call centers have been extremely accommodating in terms of letting us integrate our recruitment into their care processes. Obviously, a huge thanks to Precision Health for the funding of this project. And then we've been working with a number of mobile technology companies for this study that have been really great to work with, and I also want to give my thanks to.